Welcome back, everybody, to Dr. Sellers Educate. If this is your first time, I'm super excited to meet you and for you to learn a little bit more about all of these episodes that we have available to you right here on our YouTube channel, or if you're listening on our podcast, you have episodes listed there as well. In this episode, we're going to be talking about how to close those knowledge gaps related to clinical competencies. All right, so if you take a look at competency 1 on page 6, you're going to see under letter O, a specific competency described demonstration of ability to teach clinical skills. Believe it or not, as Nln talks about most recently during their summit, they talked about the importance of all of us being responsible for the learning that happens in the spaces, whether it's classroom, virtually, lab, or clinical. We're all responsible for making sure that student learning happens. In light of that, we wanted to focus on the clinical competencies associated with the CNE. Of course, they're also described in the CNE-CL as well as the CNE Novice. So for this snapshot, we're going to start with our resources. We'd like to role model behaviors that we ask our nurse educators to engage in to help you close those knowledge gaps so you can be successful on the certification exam. We're taking a look starting in Dr. Caputi's resource on page 18. You're going to see a whole section on demonstration of ability to teach clinical skills. So there are 5 different areas that we are going to hone in on related to this competency. This is also aligning with Patricia Benner novice to expert theory that she has developed and is a well-known nursing theorist that we continue to talk about. And she was actually at the Nln Summit where she spoke about this model and the importance of bridging theory to practice. We know that clinical teaching actually starts in the classroom. We provide unfolding case studies. We talk about scenarios in our classroom to help students sometimes reflect on their clinical experiences, or it can be introducing new knowledge for them as well. All right, so we want to do both in the classroom just to scaffold students' learning and to engage in the cognitive skills that we want students to be able to learn from. And we think about Bloom's taxonomy, where students are able to scale towards the highest level, which is creating. Along the way, students start at the lowest level on Bloom's taxonomy for the cognitive learning domain, remembering, so they do spend quite an amount of time remembering some of the concepts, the vital signs, some of those basic fundamental skills, but we want students to build on that strong foundation of those concepts and over time be able to apply and to demonstrate relationships for those concepts. Looking at the 5 specific skills associated with our ability to demonstrate the clinical teaching skills that we need to teach and for our students to learn in the clinical setting are going to include the skills lab. So thinking about those clinical learning resource centers and the valuable experiences that students are able to glean from spending dedicated time in a no-risk environment to learn about how to provide nursing care. The second area, those wonderful simulation labs where we can engage in actors and students are able to engage verbally and also with movement for our mannequins and really have that simulated experience that's going to be realistic and be more human-like for our students. And then we have virtual clinical environments, as well as the actual acute and transitional care environments, as well as our community-based environment. So all of these wonderful clinical experiences are going to help shape our nursing students to provide safe patient care in the actual clinical setting. Now we want to talk about share a success story, I should say. This is a new twist that we are providing for our snapshots. We are now including a worksheet as well as a snapshot that is going to entail a video recording for this episode. All right, so we did have a chance, as some of you know, to attend the Nln Education Summit, and we were so delighted to meet several of you there for you to see and meet Dr. Sellers or either our operations director and just hear about all of our programs and also to share with our colleagues as we learn about evidence-based practices and how we can be a better nurse educator. All right, so let's see what one of our success stories had to share with us about her journey and how she found out about us. All right, so this is real time. I was able to snap this shot while I was in person.
challenges we read it here for a time. Being able to look for the right resources. Did you struggle with any of them here? I found the right resource. Time, I did it over a school break. Okay. So I had enough time, prioritization, to prioritize that and not other family dynamics and things. That was the tough part for me, but the right resource made it all happen. Awesome. Well, congratulations. We're so happy to get great. That's what you're doing.
Just a little snapshot. You can hear there was clearly a lot of noise, a lot of great conversations happening there at the Nln Summit this year. That was in Las Vegas, always a fun place to have a conference. So we were thrilled to hear about this nurse educator story. I think we celebrate with all of our colleagues as they are proud to carry the designation as a certified nurse educator. And we want to be part of your journey as well. You heard her talk about the approach that she took. We highly recommend our 7-week study plan. And that's going to help you focus on content that you will need to, first of all, identify where your knowledge gaps are. And then second of all, you're going to review the resources, including the modules that we cover in our live C&E review, as well as our self-paced. So you have both options. We did get a question this week, and we've had this question before. What is the difference between our YouTube episodes or our podcast episodes and the actual C&E review? Even though we are up to 75, 76 episodes now, this is only estimated to be 10% of the content that you will need to know in order to pass the exam. All right, so that is why we really recommend and have seen the 100% success rate when you do actively engage in a C&E review. Of course, ours is aligned with Nln standards. We are not endorsed by Nln, so we recommend our C&E review. But if you choose a different company, that's fine, but you'll just need to do more work to align the content that they are covering in their C&E review. That's the benefit of our C&E review. We walk through all 120 concept sub-competencies or so that are covered under the 8 competencies for the C&E and C&E novice, and then for the C&E clinical is 6 competencies. All right, so that's what we recommend to help you close your knowledge gaps. And to get back to our specific snapshot, looking at teaching clinical skills, want to wrap up with you also taking a look at chapter 18 in Billings and Halstead. This chapter, dedicated chapter, if there's ever a hint that we need to fully understand the expectations related to our behaviors in the clinical setting, I think it's pretty loud and clear that since there's a whole chapter dedicated to our ability to teach in the clinical setting, I want to bring to your attention box 18.2. There you're going to see characteristics of effective clinical teachers. What does that entail? A lot of the content that we cover in our C&E review speaks to a variety of these specific behaviors, creating an inclusive environment so that our students feel comfortable in the practice area. We do that by consistently having a preclinical conference, talking to our students about their plan for the day, walking through any concerns and any anxiety that we may pick up, either verbally or non-verbally, from our students, so that they can have a beneficial and productive clinical experience where they are learning and advancing their knowledge and able to practice in a way that's going to provide excellent patient care. And then we also want to ensure there is a post-conference in addition to a reflection. By students taking the time to reflect either through a journal or a discussion, it's going to help identify those knowledge gaps for them as well. And then our goal is that we can help them close those gaps. We hope this has been helpful. We appreciate your time, and we are excited to help you as you continue towards that finish line of success. So until next time, reach out to us if you have any questions. Have a great one, everybody. Bye-bye.